Hello viewers, I'm Dr. Harsh. Today we are going to discuss tibia, right? Now, as we all know that tibia is a medial bone. Fibula contains L fibula, so that is the lateral bone of the leg. It is a medial bone. So it is homologous with the radius of the upper limb bone, right? Now let's start first with the anatomical position, right? It is of right side or left side. How to determine the side? So first we have to know its ends. The upper end is expanded, the lower end is narrow, right? So we hold it like this, upper this, lower this, not like this, right? So upper end is expanded to form medial and lateral condyles, right? Now anterior margin is anterior border of this is crest like and very sharp as shaped, right? So it should be placed then anteriorly, and the lowermost has a projection. So we have a medial bone this, so medial bone has a medial projection called medial malleolus. So it should be on the medial side. So if we hold like this, this is towards the medial side, it's a medial bone. So this is of the right side, right? So medial bone. If we place it towards this left side, it becomes a lateral bone, right? So it is a medial, so we should look for the medial malleolus, the sides which it is projected right, so it is of the right side, right? Now let's discuss its parts individually now. Upper end, shaft and lower end. Like any other long bone, we has upper end, shaft and lower end. Let's discuss the upper end. Upper end has two condyles, medial condyle and lateral condyle. Medial condyle is larger than the lateral condyle, right? So the condyles of femur, they articulate with the both of the condyles, right? So in the center it is concave, so that the condyles of the femur, they get fit into the center, and towards the periphery they are separated from this surface by the medial and lateral malleolus, lemniscus respectively, right? So now this is medial malleolus. It's the lateral margin of the medial malleolus is upturned to enclose this is medial intercondylar area, medial prominence, and lateral, this is the lateral condyle. Lateral condyle's medial margin, it is elevated to enclose this intercondylar area, right? Now if we see the surface, anterior and medial surface has vascular foramina on the medial malleolus, right? And posteriorly we have a groove, right, present behind the medial malleolus. So this is medial malleolus. Let's discuss the lateral malleolus. Lateral malleolus has a fibular facet posteriorly. So fibular facet which articulates with the fibula, right? We also have a groove superior medial to this fibular facet here, and anteriorly we have a flat tubercle present which is called Gerdy's tubercle, G-E-R-D-Y, Gerdy's tubercle, right? Anteriorly if we see, we have a tibial tuberosity triangular, upper part of which is smooth and lower part is rough, right? So this is upper end. Now come to the shaft. Shaft, as I have discussed, has an anterior prominent margin, anterior border, we have a medial border, we have a lateral border. 3 borders and 3 surfaces. Let's start with the anterior border. So anterior border starts from the lower margin of this part is this tibial tuberosity. It starts from the lower part of it is S-shaped, see, it is S-shaped, and ends on to the anterior margin of the medial malleolus. Okay, medial malleolus ke anterior border pe it ends, right? So in the upper part it is concave laterally, in the medial part it is concave medially, as shaped, right? So medial border, it arises below the groove, groove on the medial malleolus, and ends on to the posterior border of the medial malleolus. This one is medial border. And last border is interosseous or lateral border, right? So interosseous border begins just in front of this fibular facet, see, in front of the fibular facet, and ends at the anterior margin of the fibular notch. So this is fibular notch, where the lower end of the fibula articulates, right? Note that upper end has fibular facet, lower end has fibular notch. So these are surface borders. Now come to the surfaces. Now this is medial surface, this is lateral surface, and this one is posterior surface. Medial surface is mainly subcutaneous. Anterior surface has anterior surface has its attachment, like tibialis anterior originates from the upper 2/3 of this lateral surface, medial, lateral and posterior surface. So medial surface is subcutaneous except for the upper end, right? And this one is the lateral surface where the tibialis anterior originates, right? Now come to the posterior surface. So posterior surface has a marking which is called soleal line. So this is soleal line which originates behind the fibular facet and ends by meeting the medial border. See the and ends by meeting the medial border, right? So above the soleal line we have a triangular area. Below this part we have a ridge. Starting from here we have a ridge which divides this surface into lateral and medial parts, right? I will discuss the attachments later on. Now come to the lower end. So lower end has 5 surfaces. I hold it like in the anatomical position. So this is anterior surface, this is medial surface, this fibular notch, this is lateral surface, this is smaller one is posterior surface, and inferior one is this one is the inferior surface. So inferior surface this is the talus bone, right? So it articulates with the talus. So this is the trochlear surface of the talus, head is directed forwards, right? So it articulates with the trochlear surface of the talus, right? Now come to the attachments. Let's start from the upper end. As I have discussed, they articulate with the condyles of the femur, right? Now we have a groove where we have attachment of the semimembranosus muscle, right? Medial meniscus and semimembranosus muscle got inserted into this groove, right? So the capsule of the knee joint, it is attached onto the whole margin of the articular area, right? So these are the attachment of the medial meniscus. Similarly, on the lateral meniscus, on the lateral condyle, the capsule of the tibiofibular joint is attached here onto the margins of this fibular facet, right?